You may be familiar with speech-language pathologists. We work in schools with children who have autism or with those who have difficulty saying sounds like R or S. Did you know that speech-language pathologists also work in hospitals? We work with people of all ages, from newborns to elderly patients. Speech pathologists are a part of Loyola's rehabilitation team. In the hospital setting, we help patients recover from strokes, traumatic brain injuries, surgeries, and prolonged illnesses like those related to cancer and organ transplants. This may include treatment for cognitive and communication disorders, like trouble thinking of words, slurred speech, or memory deficits. However, one of our largest roles, and perhaps the least understood role, is addressing dysphagia. Dysphagia is the medical term for difficulty swallowing. People who have dysphagia may choke or cough immediately after swallowing. They may take a long time to eat, have trouble chewing, or have difficulty swallowing pills. Dysphagia can lead to dehydration and malnutrition, lung infections, discomfort during meals, or isolation in social settings. Dysphagia can also lead to aspiration. Aspiration refers to food or liquid entering the airway. This can cause a person to choke or cough immediately after swallowing. Speech-language pathologists do tests to determine if a patient is aspirating. These tests involve taking pictures while a patient swallows. One test is called a video fluoroscopic swallow study, or video swallow. During a video swallow, patients swallow barium. The doctor takes an X-ray to see how food and liquid pass through the throat. Another test performed by a speech-language pathologist is called the fiber optic endoscopic evaluation of swallowing, or FEES. During this test, a camera is inserted in the nose to see the throat. We are able to see the vocal folds and the trachea as a patient eats and drinks. If a swallowing problem is identified, we establish a therapy plan. We modify a patient's diet or teach compensations or postures to help make swallowing easier. We also teach swallowing exercises to improve the strength of swallow muscles. Speech pathologists are found in many areas of the hospital. We work with neurologists, radiologists, ENTs, and gastrointestinal doctors, among many others. You will also see speech-language pathologists working with other staff, including nurses, dietitians, occupational therapists, physical therapists, social workers, and many more. If you or any of your loved ones are in need of speech-language pathology services, please call to schedule an appointment at one of our locations.